Thank you for watching this video from Virginia Breast Cancer Foundation. Today, we're going to learn a little bit more about oral health and how that relates to breast cancer treatment. Today, I have Dr. Nazy Zahedi and Dr. Sarah Glass with us. They're going to be telling us a little bit more about how they work with people who are experiencing breast cancer and a little bit more about the effects of breast cancer on oral health. Dr. Glass, would you like to introduce yourself?
Sure, I'd be happy to. And thank you so much for inviting us to talk with you today. So as you heard, I'm Dr. Glass. I'm an oral and maxillofacial pathologist, which to tell you a little bit more about what that is, it's a specialty in dentistry that really focuses on the diagnosis of conditions inside the oral cavity. So if someone has a biopsy where they remove a small piece of tissue from the oral cavity, it gets sent to someone like me where I look at it under the microscope and provide a diagnosis. So having said that, I really like to help when there needs to be a bridge between medicine and dentistry. So that's where I come in.
Dr. Zahedi?
Thank you so much for the invitation as well. I'm Nazy Zahedi. I'm a general dentist. I work in the hospital setting at VCU. My focus is getting internal referrals from all over the hospital, whether it's a cancer patient or patients going through cardiothoracic surgeries and orthopedic surgeries. We do a scope of treatments for all the patients that are referred to us.
Great. And I'm going to start with some questions for you, Dr. Glass. So I think people don't necessarily think about oral health when it comes to experiencing breast cancer, going through breast cancer treatment. Can you tell me a little bit about how that treatment can affect oral health?
Sure, I'd be happy to. And I always like to start by emphasizing that even though there's medicine and dentistry, the mouth is not separate from the body. It's very much connected. And so we have to make sure that a person is taken care of really their whole well-being. So when it comes to breast cancer and oral health, there are lots of impacts that therapy can have when we're talking about the oral cavity. Some of the things that we might encounter with our patients is mucositis or inflammation of the mucosa, where we have pain and ulcerations. Patients may be prone to infections, more cavities or periodontal disease. We can see changes in the saliva or discomfort in the oral cavity. We can see loss of tooth structure, some demineralization, which can also lead again to more cavities. We may see candidiasis or yeast infections or thrush in the setting of immunosuppression. Patients may be on a variety of medications for their breast cancer treatment. So bisphosphonates, for example, have a particular side effect we see in the oral cavity. You may hear a little bit more about from Dr. Zahedi, but we call that medication-related osteonecrosis of the jaw. And then finally, also, there's the possibility of breast cancer metastasizing to the soft tissue of the oral cavity or even the jawbone. So lots of things can be going on with a person's overall body and with their diagnosis of breast cancer. And there may be things that need to be addressed or taken care of when it comes to their oral cavity and their oral health.
Yeah, that's important to point out, because I know that dentistry and medicine have been separated for so long, but I know there's some groups and there's a bit of a movement now to connect it because it's all part of the same body. And specifically, I have a question about chemotherapy. I know that, it affects the hair, skin, and nails. Does it have an effect on the gums or tooth enamel as well? And what can people maybe expect?
Sure. So it absolutely has an impact in the oral cavity. The cells inside the oral cavity are turning over fairly quickly, and so we can see an impact of those treatments in the oral cavity. I would definitely start with mucositis, talking about that a little bit more as it pertains to chemotherapy. So as I mentioned, it's inflammation of the mucosa, but we can have breakdown of the tissue resulting in painful ulcerations or sores. And that can really have an impact on patients in terms of their ability to eat, experiencing pain and discomfort. And so that's one of the the bigger side effects we see with chemotherapy that we would want to make sure that we're assessing patients for, and if they're experiencing it, making sure we get them some symptomatic therapies to help get them through that side effect of chemotherapy. So that's one of the bigger things we see with the soft tissue inside the mouth related to that medication. In terms of the enamel or the teeth, because patients are, at risk of dry mouth and demineralization of the tooth structure, we want to make sure that their teeth have been properly assessed to make sure that we are addressing any cavities that they have, especially prior to treatment, which you'll hear more about from Dr. Zahedi, who does see these patients chairside. So we want to make sure that we set them up for success in terms of their oral health to make sure that we address any potential problems before they actually become problems.
So it's important for patients to talk to their doctors about what's going on inside their mouth, in addition to other symptoms they may be experiencing, like nausea or loss of appetite, things like that.
Absolutely.
Okay. Great. And so after someone is in active treatment, what about hormonal treatments like tamoxifen or aromatase inhibitors? They block estrogen, which is, throughout the body. So what effect does that maybe have on someone's oral health?
So there are some interesting conditions we can see in the oral cavity that we think is related to hormones in one way or another. So we see with, children who are going through puberty, we can see puberty gingivitis, or patients who are pregnant, we can sometimes see this soft tissue mass called a pyogenic granuloma. So there are things that happen inside the oral cavity that we think are related to hormones. So these medications definitely can have impacts in the oral cavity. I think there's still lots of studies being done to better understand and define what they are and really to understand the mechanisms. But some of the studies that I have reviewed seem to indicate or suggest an increase in periodontitis or gum disease, joint pain, dry mouth, and one of them actually had self-reported poorer oral health when reviewing patients on those therapies. So certainly, again, impacts that they can have on the oral cavity, and all the more reason to make sure that they have an oral health care provider to help navigate some of those things they might be experiencing.
Absolutely. And again, like sharing what's going on inside their mouth with their oncologist, who can have conversations with oral health professionals about how to proceed. So thank you. Now, Dr. Zahedi, as a hospital dentist, what kinds of things do you look for when you're seeing a breast cancer patient?
As an overall, for all the cancer patients, we really hope that they get a dental exam before they start the treatment. We do a complete radiographs. We take x-rays of all their teeth. We look inside the mouth, assess their periodontal condition to see if they have healthy gums to begin with. We look for any teeth with large decay, any fractured teeth, any potential sites for infections in the patient's mouth, because they'll be at high risk for infections once they start their chemotherapy, because they become immune suppressed. So our focus is to diagnose and treat and get their mouths as stable and optimized as possible before they even go. That means if they need root canals, they get that done. If they need to have some teeth removed by surgical extractions, they get that done. If they have cavities, they get those restored. And if they have lots of tartar, they haven't been to a dentist, they haven't had a good overall hygiene program in the past, we make sure they get on that. But most importantly, we kind of give them information how to take care of their teeth while they're being treated. Because a lot of times patients, because of the mucositis that they experience, a lot of them do, they stop brushing or they stop flossing, or because their cells, their white blood cell counts, or their doctor or platelet counts, or everything gets whacked up. And so they're afraid that they cause more bleeding if they brush. So we give them extra soft toothbrushes We give them children's toothpaste because a lot of times their mouth is so sensitive, even minty products or flavored toothpaste like mint and cinnamon. Most of the toothpaste are that burn their mouths really well. We give them oral and lip lubricants. We give them specialized toothpaste to use to prevent decay because their mouths get so dry. So we give them fluoridated toothpaste, prescription dose. So the most important things to be seen prior to eliminate so they don't have problems during the chemotherapy, because that stops their treatments.
Yeah, so what does happen if someone needs a dental procedure while they're undergoing chemotherapy? You know,
Yes,
because things happen, like crowns fall out, or people, despite good care, they develop a cavity anyway. So what does that look like?
absolutely. The first thing that we do is contact the oncologist, let them know that this is happening, and we tell them the extent of the problem. Is it something easily repaired, or do they need to have surgical extractions or root canals, or is it something that we can immediately take care of now, or is it best just to do something temporary and then for them to take care of it later if it's going to delay their treatments. So if they say go ahead, most patients need to have pre-medications with antibiotics so that because their immune system is so suppressed, and there's a lot of bacteria in the mouth, we make sure that they have antibiotics prior to the dental visits. We make sure their blood counts are feasible for treatments, and then we proceed. But first and foremost is the contact with their oncologist before we proceed with any treatments, really.
Yeah, it's good to hear about more, just medical professionals talking to each other, because it's all happening within the same body of the patient.
Yeah, we're blessed because it's a hospital system. It's just a quick text message within the hospital or within the hospital emails or messaging systems through Epic, the software. We can get a contact right away and a response quickly from all our physicians here.
So after treatment or after active treatment, what should survivors maybe look for in their dental health? And we heard a little bit from Dr. Glass, but what are some things that they should be sure to bring up to a dentist?
Sure. Because they are possibly still ongoing with their anti-estrogen hormonal therapies, they are dry. Their lubrication kind of in their mucosa has decreased because of these medications. So they'll be at high risk for cavities or caries. So we have to really make sure that their oral hygiene is good. They get dental visits regularly from a dentist every 3 to 4 months. A lot of the AIs are put on bisphosphonates because of the osteopenia and osteoporosis, and also a lot of the patients that are postmenopausal or they're high risk for metastases are taking these bisphosphonates. They can have issues in their oral cavities that need to be monitored if they have any problems right away. So they need to be monitored closely by their dentist every 3 to 4 months. They need to be on a really good oral hygiene routine, using oral lubrications, using fluoridated toothpaste, water pick appliances, whatever they can to keep their mouths clean, and making sure they don't induce trauma unnecessarily to their gums or to expose the bone area. And they have to let all their providers know they have had cancer therapy, so they're cautious. If they're on bisphosphonates, they don't have periodontal surgery or extensive extractions, and without being in contact with to see the dosage of what they have had, how long they've been on there, because they'll be high risk for Emerald, which Dr. Glass mentioned, which is a medication-related osteonecrosis of the jaw. Those are very important things that we have to keep an eye on.
Yeah, so just to share a little bit, my mother was recently diagnosed with breast cancer, and she's completed her treatment, but she's considering bisphosphonate herself. So it's something that has stuck in my brain, and realized like, oh, again, it's the whole body is connected. So you mentioned a little bit, but I want to expand it to both of you. So why is it so beneficial for a patient to share with their regular dentist, even after they've completed treatment, or if they're still on their hormonal therapy, that they are a breast cancer survivor? What, just talk a little bit more about why that is so important to share with their regular dentist.
I don't know, Dr. Glass, would you like to start?
Sure, thank you. I think it goes back to the concept of, the mouth and body is connected, and that healthcare is always better when there's a team and everyone's on the same page. So I think it's important to really share everything that's going on, so that everyone in the healthcare team is aware, and everyone has their particular role that they can play in order to make sure that the patient is healthy and doing well. And so when there's transparency in terms of what medical conditions a patient may have or what medications they're on, even if they think that it, oh, why does the dentist need to know that? Well, they need to know because they're part of your healthcare team, and there may be certain implications. So really, it's best when all healthcare providers work together, and it's best when the patient notifies all of their healthcare providers what's going on.
So yeah, because bisphosphonates are important for patients, we certainly encourage, if it's been recommended, to take them. A lot of patients hear all the side effects and they don't want to start the treatment. We always tell the patients, this is an important thing. It prevents fractures. It prevents bony metastasis from occurring. You need to take this. But on the side note is, you just need to be monitored for any changes regularly with your dentist, with radiographs, and with oral examinations. So, and it can be treated. Even if it's you get unfortunate, it's not something they cannot treat, or it's the end of the world. It's a very treatable condition. We'd like to avoid it, but it can be treated by surgeons. Most of the time, oral maxillofacial surgeons within the hospital systems or in the private practice can be treating these conditions. So we never discourage them from taking these.
Yeah, and that's it's good for you to mention, because I hadn't heard that breast cancer patients or patients on certain therapies might need to see the dentist more often. Knowing that they might need to go every 3 or 4 months, it's more often than the recommended 6 months, which is a struggle for some folks.
Financially, yes, that could be, yes, financially.
Yes. So that's a great segue into my next question. So I know recently that dental was added to adult Medicaid.
Beautiful.
So how do you think that will affect cancer patients, breast cancer patients?
So it is beautiful, because a lot of the patients really avoided going to dentists, period. Not just because because they couldn't afford it, they didn't have dental insurance. So even if the oncologist would recommend them to go see a dentist, they would not go. Now with the Medicaid availability, there is no reason or excuse not to go see a dentist. So it has opened up a lot of doors for patients who previously couldn't afford it or have the opportunity to go see a dentist. So more patients are being seen, more patients are being helped. So it's a wonderful thing for adult Medicaid to start in Virginia.
And hopefully that means that more patients have better oral health, or at least have more of a potential to do that when they do need to start breast cancer treatment.
Absolutely, because education. If you don't know something that, it's our responsibility to make sure patients know how to take care of their teeth and the importance of it. Just see a dental provider or a hygienist will be much beneficial to most of the general public.
And I guess my last question for both of you is, what question did I not ask that you would like to answer? What's one thing that you want folks to take away from this short video? Dr. Glass, you want to go first?
Sure. I think I've had the opportunity to express what I think is really the most important thing, and that's, again, the mouth and body are connected. There are sometimes instances where people feel like they fall through the cracks a little bit between medicine and dentistry, and there are lots of us out there that are trying to make sure there's a bridge between the two. So I just want to emphasize that if there's something abnormal inside your mouth and you're unsure about it, please reach out to any of your healthcare providers. There are people out there that will help you with it. So don't be afraid to mention it or speak out. There are people who can help.
Thank you. Dr. Zahedi?
You asked very, very good questions. You covered the whole spectrum. Some of the side effects of AI, I was like, some of the patients have issues with, besides the dryness of the mouth, they have issues with jaw pain and bone pain. Even with tamoxifen, they have more clenching. Patients complain they clench their teeth more, they have jaw issues. So again, we always encourage them again to tell their dentists, tell their doctors, because simple remedies of having the night guard appliances to help them would be beneficial for them.
Great. Thank you both so much for your time today. I really appreciate it. And yeah, I think this is a great discussion, something that people don't normally connect with breast cancer. So thank you both.
Thank you so much.
Thank you. Yes,
thank you.
Right. Thanks.
Thank you.
Bye-bye.